Rich here from Vet Triage. We are going through this issue of JAVMA from February 15, 2015. This one comes out of the Veterinary Medical School in California, Davis. So we're talking about eye tests in cats. And in the bottom picture there is our dogs, and that's just an example for those who are not familiar with the Schirmer tear test. This is one of the tests they're going to study in this paper here. It involves taking that ruler strip and placing it in the space between the eyelid and the eyeball, and then as the tears get produced, you can see that the strip is getting wet, like this part is getting wet here. And so I don't know, it stays in there for like a minute or something, and then you to remove it, and you can measure the tear production. You may ask, why don't you sedate the animals or anesthetize them to do this? Because that looks like it's uncomfortable. And they don't mention it in this paper, which is why I'll mention it now. But I think that there is a belief, or maybe it's been shown, that sedating an animal or anesthetizing them does affect tear production. Eyes get dry. That's why if you're under anesthesia, whether you're a person, I presume, or an animal, we end up placing tear lubricant in their eyes every so often to keep them moist, because they're not blinking during the procedure, and maybe there's something about being under sedation or anesthesia that is affecting tear production or tear quality, or both. I don't know. But not that I don't know, because I know that's true. I just don't know the details of it. But anyway, so we do these tests in animals while they're awake, because that's going to be the more accurate diagnostic, even though you can imagine if you don't have a good boy, then they are going to fight you on this, and some animals have to be sedated just to at least get a rough estimate of what's going on with their eyes. But most of them are tolerant of these diagnostics. So anyway, this paper is reference values, intertest correlations, and test-retest repeatability of selected tear film tests in healthy cats. The objective: to determine reference values, intertest correlations, and test-retest repeatability of the Schirmer tear test, the phenol red thread test, the tear film breakup time, the tear osmolarity, and the myometry in healthy cats. So 135 healthy domestic cats were tested. Each test was performed once in 120 cats and then repeated in 40 cats. The results showed the median values were 18 millimeters per minute for the Schirmer tear test, 29 millimeters per 15 seconds for the phenol red thread test, 12.4 seconds for the tear film breakup time, 322 milliosmoles per liter for osmolarity, and 32 myometry units for peak myometry value. The Schirmer tear test and the phenol red thread test were positively correlated. Age was weakly associated with the tear film breakup test and osmolarity. Myometry measurements were higher for strips that contacted the tear film at 285 mu, which I think is myometry units, than for those that touched the eyelid margin at 32 mu. Conclusions and clinical relevance: tear deficiency should be suspected in cats with a Schirmer tear test of less than 9 millimeter per minute, or those that have a phenol red thread test at less than 15 millimeter per 15 seconds, or a tear film breakup time of less than 9 to 10 seconds. Poor correlation among tests suggests that thorough tear film analysis requires performance of multiple tests in concert. There's poor test-retest repeatability. So repeated tests, when used to monitor tear film dysfunction, response to treatment may not be accurate. All right, so let's go through it. Introduction: the surface of the eye is coated with a thin film of tears, critical for ocular comfort, optical clarity, and corneoconjunctival health. The tear film keeps the ocular surface moist, providing nutrients and protection against debris and pathogens, and helps transport waste away from the ocular surface, as well as provides a smooth optical surface for refraction. The tear film has traditionally been described as a trilaminar structure, an inner mucinous layer secreted by conjunctival and corneal cells, a middle aqueous layer secreted by the lacrimal glands, and the outer lipid layer composed of meibium and secreted by the meibomian glands. Current concepts, however, consider it a bilayered structure with an inner aqueous-mucinous phase and outer lipid phase. Disruption of the aqueous component results in quantitative tear film deficiency, which is keratoconjunctivitis sicca or KCS or dry eye. And a disturbance in the lipid or mucus component of tears results in a qualitative tear film deficiency, which causes instability and premature evaporation or breakup of the tear film with resultant keratoconjunctival injury. The aqueous component of the tears is commonly assessed from the Schirmer tear test. There's a test 1 and test 2. They don't define the difference here. I'm not sure what the difference are, but they use 1 in this paper. Then there's the phenol red thread test. There is fluorophotometry. There is meniscometry, and there's the assessment of tear osmolarity. Current techniques to characterize meibium, which is the portion of the outer lipid layer of the tears, include, in order of increasing invasiveness, evaporimetry, inferiorimetry, myobimetry, meibium expression with assessment of its physicochemical properties, and myobography. Mucins are typically assessed on the basis of tear film breakup time, biochemical analysis of tears, cytology or histopath of goblet cell density. Tear assays in people include the wavefront aberrometry, the corneal topography, the advanced imaging or optical coherent tomography and confocal microscopy, and visual acuity testing. There is increasing evidence that quantitative and qualitative tear film deficiencies are an important cofactor or cause of some of the most common and frustrating ocular diseases in cats, such as dry eye, chronic non-healing corneal ulcers, corneal sequestration, conjunctivitis, and herpes virus 1 infection causing keratoconjunctivitis. Okay, materials and methods. Median age of cats in the study, 2.6 years. No known history of disease. No sign of adnexal or ocular disease on examination. They were group housed in cages with room temperatures maintained between 18 degrees and 24 degrees Celsius and a light-dark cycle of 14 hours of light, 10 hours of darkness. The cats were maintained in a specific pathogen-free facility, seronegative for feline herpes virus 1, feline calicivirus, feline coronavirus, FIV, and FELV. The interval between 2 tests was at least 4 hours. To evaluate retest repeatability, each test was repeated by the same evaluator under identical conditions 1 week later on 40 of these cats, so 80 eyes. The Schirmer tear test 1 had a 60-second time lapse, so that would be the case here. They'd wait a minute before removing the strip. The phenol red thread test was removed after 15 seconds. That's why that measurement is per 15 seconds. Tear osmometry was measured using a proprietary osmometer. Tear film breakup time was performed with a modified fluorescein impregnated paper strip and a slit lamp biomicroscope, and then myometry was tested with a myometer. All right, here's a picture. This is the cat. Okay, so it's describing their different tests they ran these kitty cats. By the way, notice that there's no gloves in that human. Right, so it's weird. It's weird to have a pathogen-free test environment, but then the person who's doing the test isn't like dressed up in a hazmat suit and wearing gloves and stuff. Because what if that owner or that human has cats at home, and those cats have viral infections, then they bring the virus to these cats. So that's a bit weird to not standardize things to that degree if you're going to go through all the trouble of having a pathogen-free environment for these cats. And I don't know if they necessarily sterilize the equipment between cats. What if there's something was spread from one cat to the other? I know these cats are all negative for all these viruses, but still, what about bacteria, or what about a false negative virus test or whatever? Results. No significant difference was detected between right and left eyes. Reference values expressed as a median were 18 millimeters per minute for Schirmer tear test, 29 millimeters per 15 seconds for the phenol red thread test, 12.4 seconds for the tear film breakup time, 322 milliosmoles per liter for tear osmolarity, and 32 MUs for the peak myometry value. A significant association was not detected between peak myometry value and drying time between 5 and 10 minutes. Median peak myometry values obtained from samples measured after 30 minutes of air drying were not significantly different from those that were measured after 5 to 10 minutes. Peak myometry measurements were significantly higher for strips that came in contact with the aqueous component of the tear film than for strips that touched the eyelid margin. The age of Kass did not affect the values. There was a positive but weak correlation or association between age and they keep using abbreviations, so I have to go back to the key, and the tear film breakup time. And between age and tear osmolarity values, there was a weak positive correlation there. For both tests, values had a tendency to increase until about 7 years old, and then they decreased with age. Neutered males had significantly longer median tear film breakup times compared with values of sexually intact females. Sexually intact males had significantly higher median phenol red thread test results than did intact females and spayed females. Intact males had significantly lower tear osmolarity than did neutered males, spayed females, and sexually intact females. The median difference in measurements between the left and right eyes of the same cat recorded during the same session was Schirmer tear test, 3 millimeters per minute. The phenol red thread test was 3 millimeters per 15 seconds. The tear film breakup time was 1.6 seconds. Tear osmolarity, 12 milliosmoles per liter, and then peak myometry value, 15 MUs, and myometry area under the curve, 71 MUs. As far as intertest correlations, Schirmer tear test and the phenol red thread test had a weak positive correlation. The peak and area under the curve values for myometry were also positively correlated. Finally, the median difference in median measurements from the same eye at different sessions were as follows. Schirmer tear test, 3 millimeters per minute. The phenol red thread test was 3 millimeters per 15 seconds. The tear film breakup time was 2.2 seconds. Tear osmolarity, 19 milliosmoles per liter. Peak myometry value of 10 MUs, and peak myometry area under the curve, 52 MUs. Okay, discussion. The median Schirmer tear test value in the present study of 18 millimeters per minute is similar to previous studies of 14.3 to 20.2 millimeters per minute. Unlike dogs, in which tear production decreases with increasing age, but is unchanged by sex, we found no effect of age or sex in the feline population. Another study suggested that Schirmer tear test values of less than 6 millimeters per minute is abnormal. Data from the present study suggested less than 9 millimeter per minute, together with clinical signs of dry eye, will be supportive of aqueous tear deficiency. The diagnosis of dry eye in cats is further complicated by a textbook that claims healthy cats can have 0 millimeters per minute Schirmer tear test. However, no healthy cat in this study was less than 7. Additionally, it has been assessed that low Schirmer tear test values in cats may result from stress-induced increased sympathetic tone, causing a temporary reduction in tearing during testing. The median phenol red thread test value for cats in this study was 29 millimeters per 15 seconds, significantly higher values for intact males than intact and spayed females. Another study found a median of 23 millimeters per 15 seconds. In people, there is evidence that androgenic hormones promote lacrimal function. The phenol red thread test is believed not to cause tear instability and therefore may interfere minimally with subsequent tear film tests performed during the same examination. Assessment of an in vitro variation in absorptive capacity of phenol red threads suggests that they are more reliable than Schirmer tear test strips. Taken together, this data and findings from the present study suggest that the Phenol red thread test may be a useful alternative to Schirmer tear test for measurement of aqueous tear production in healthy cats, as has been reported in humans. The phenol red thread test is believed principally to measure residual tear film volume of the inferior conjunctival fornix, whereas a Schirmer tear test is thought to measure residual tear volume and reflex tear production. For the tear film breakup time, this is a test that's recommended as a non-invasive test to aid in the diagnosis of qualitative tear film abnormalities. Rapid tear film breakup time suggests an unstable tear film and has been reported for cats with conjunctivitis, chronic non-healing ulcers, and corneal sequestra, and feline herpes virus 1 infection. In this study, this test, with a median of 12.4 seconds, was shorter than other reports of 13.5 to 21 seconds. Tear osmolarity is principally determined by the concentration of solutes in the aqueous component of the tear film. Electrolytes play a major role, and proteins and sugars are minor contributors. Imbalances between tear production and elimination cause tear film instability and hyperosmolarity in people and in rabbits. As a result, tear osmolarity has been recommended as an objective clinical measurement of the balance between these complex tear film dynamics. In people, tear film hyperosmolarity is pivotal pathophysiological factor in dry eye disease, with healthy subjects having low and stable tear osmolarity values, and those with dry eye have high and less stable values. Healthy humans have a median tear osmolarity of 301 milliosmoles per liter. Repeated measurements in human subjects have little variability. This study revealed that tear osmolarity in healthy cats with 322 milliosmoles per liter is higher than that of people, but similar to another study of healthy cats that had a mean of 328.5 milliosmoles per liter. Tear osmolarity has not been shown to differ between cats with and without conjunctivitis. Taken together, this data suggests that inherent variability in feline tear osmolarity, or in this assay, reduces its diagnostic benefit in cats. Myometry was assessed in the present study as a novel and non-invasive approach to quantity lipid content at the lid margins in a population of healthy cats. The median peak myometry value in this population was 32 MUs, which is lower than reported values in cats of 67.6 MUs, dogs at 179 to 211 MUs, and humans 250 to 268 MU. A repeated measurement can vary from the initial value for a variety of reasons, including variation in the diagnostic test or the instrument, environmental factors like ambient temperature, humidity, and noise, psychological factors like anxiety, and examiner consistency. Test-retest repeatability defines the extent to which a measurement is free from random error and is expressed as relative reliability or absolute reliability. Relative reliability indicates to what extent repeated measurements from the same individual will be consistently positioned or ranked within the same test group, and was evaluated in the present study by interclass correlation coefficient. Absolute reliability evaluates to what degree repeated measurements vary for individuals and was evaluated on the basis of 95% limits of agreement and the Bland-Alfman plots. In general, the higher the interclass correlation coefficient and the narrower the limits of agreement, the more reliable the measurement, with an intraclass correlation coefficient of over 0.75 reported to indicate good reliability. So for the 5-tier film tests performed in this study, they were all below the preferred value. The relatively wide 95% limits of agreement they found in this study for all tier assays in the present study also suggests that the tests were of low repeatability in the feline population tested. Poor test-retest repeatability for all assays tested in healthy cats suggests that the use of any of the assays for the monitoring of disease progression or efficacy of therapeutic interventions may not be reliable. Very cool. It's a good study despite what the limitations that I mentioned earlier. But I didn't realize dry eye was even common enough for cats to warrant this type of investigation. But obviously, there are many diseases in cats' eyes that can affect their tear production rate and quality. So cool. All right, everybody. Thanks for supporting the channel. We'll see you in the next one. Bye-bye.